Today, development economists generally agree that early childhood parenting interventions are highly effective tools for human capital formation. When run as highly controlled, well-funded pilot studies with small participant pools, these programs routinely demonstrate massive potential to boost child development. Expanding these precise, researcher-controlled pilots into decentralized, national-scale policies consistently introduces severe friction. Efficacy often drops. Part of the difficulty in diagnosing why these scaled programs struggle comes from the data itself. Pooling hundreds of mixed randomized controlled trials into a single average creates statistical noise that obscures the specific mechanics of intervention failure. To cut through this noise, we have to isolate exactly what works, and a 2024 working paper from the National Bureau of Economic Research by Dadisman, Nickow, and Oriopoulos provides the necessary filter. Their methodology is unusually strict. They isolated 90 specific RCTs and instead evaluated them exclusively on directly measured child learning outcomes. They eliminated parent-reported surveys entirely to remove bias. By systematically filtering this dataset across geography, curriculum design, and delivery mode, we can extract a specific, scalable intervention profile. We are bypassing the theoretical discussions of why early childhood matters. This analysis focuses strictly on the mechanical engineering of how successful delivery is executed. Solving the scale-up problem requires abandoning generalized pooled averages. We have to build a precise, context-dependent formula. This scatterplot maps 90 studies by sample size, yielding a pooled effect size of 0.218 standard deviations. Geographically, the high-income country median drops to 0.115. By contrast, low- and middle-income countries surge to 0.303 standard deviations. This disparity is not a program failure in wealthier nations. It reflects different baseline institutional environments. High-income countries already deploy robust educational safety nets and public resources. The marginal impact of adding one specific parenting program is mathematically smaller. In emerging economies, lacking developmental infrastructure means a targeted parenting intervention provides a massive relative leap. Macroeconomic location dictates baseline potential. Geographic context is the absolute first required input for policy design. With geography established, we can examine the core content of the programs themselves. The dataset categorizes interventions into 4 curriculum typologies: cognitive stimulation, language, attachment, and lifestyle. Lifestyle programs like the Nurse-Family Partnership train caregivers to manage broad environmental factors, focusing heavily on maternal health, abuse reduction, and local support networks. In this heat map matrix, lifestyle programs generate the lowest short-term cognitive impacts, producing an effect size of 0.13 standard deviations. Cognitive stimulation programs operate differently, equipping parents with targeted activities to accelerate neural learning, making them the highest performing variable. These high-performing cognitive programs trace back to the iconic 1980s Jamaica Reach-Up model. Language and attachment curricula show moderate success, but lack the overwhelming global data of cognitive stimulation. If the strict policy goal is driving child learning outcomes, cognitive stimulation must be the foundation. There is an entrenched assumption within development economics regarding exactly how this curriculum should be taught. High-intensity, one-on-one home visiting is widely considered the gold standard for behavioral intervention. This bar chart breaks down the aggregate effectiveness of home visiting against group delivery models in the NBER data. Surprisingly, group delivery achieves statistical parity, pulling slightly ahead at an effect size of 0.23 against home visiting's 0.21. Dispersing attention across a group does not degrade child learning. Peer interaction actually reinforces the curriculum. In a standard group session, multiple caregivers receive instruction simultaneously. Hosting multiple families alters the labor equation, allowing one interventionist to serve an entire cohort. To understand the financial implications, we examine a 2020 randomized trial testing the models head-to-head. This financial breakdown shows group sessions operating at a massive cost advantage, $38 per child, compared to $135 for home visiting. A separate Kenya trial reinforced this, calculating a 127% return on investment for group-only models. The logistical exception occurs only when regional population density is extremely sparse, or when transportation costs physically prohibit parents from gathering. In those cases, home visiting remains a necessary fallback. Group delivery proves maximum intensity does not equal maximum impact. It is the optimal delivery vehicle. Even with a properly designed group program, national scale-ups occasionally failed to produce significant impacts. The final scaling friction lies within the bureaucracy itself. A recent randomized trial in Brazil isolates this variable of organizational implementation and state capacity perfectly. The study utilized a split design, deploying the identical curriculum via two entirely different channels. One was a dedicated cadre of workers. The other was an existing, generalized government health agency. The existing agency failed to produce significant impacts. Their employees lacked disposable time for new protocols. Staff burnout and competing priorities at the generalized agency eroded the dosage frequency required for change. The curriculum was sound, but the administrative bandwidth was tapped out. We can contrast this failure with the successful Mexican education initial scale-up. Mexico protected administrative bandwidth by nesting the program's logistics within an existing national cash transfer program. Scaling success depends as much on a strictly protected administrative infrastructure as on a proven curriculum. Synthesizing the data from these 90 studies gives policymakers in resource-constrained environments a clear optimization formula. A cognitive stimulation curriculum, deployed via a group delivery model, supported by dedicated administrative bandwidth, yields maximized scalable impact. To completely bypass the lingering threat of administrative friction and labor shortages, development economists are testing information and communication technology, or ICT, as the next experimental frontier. Automated text messaging and digital nudging attempt to remove the human administrative bottleneck entirely. Early text-based interventions show modest but highly scalable impacts via simple, low-bandwidth digital delivery. As these devices show, the interventions rely on basic SMS technology, not advanced broadband smartphones. Parents often face behavioral frictions rather than informational ones. A simple text message solved the cognitive bandwidth issue for a busy caregiver, far better than demanding they log into a complex online learning module. There is a current limitation. While ICT excels at behavioral nudging, it struggles to communicate the complex, information-intensive material that a human-led group can easily manage. With the core curriculum components identified, the next hurdle for the field is engineering the logistical and digital architecture,